I am Dr. Balaji. I am a cardiologist at the KIMS hospital. I am an interventional cardiologist here and I have been here with the institute for more than 6 years. I was born and brought up in holy town of Tirupati, and whole my education was in Tirupati till my MD, and I got my DM degree from Usmania in year 2000. Since then I have been practicing cardiology. My areas of interest are actually dual extremes. I practice interventional cardiology as well as preventive cardiology. I am one of the very few fellows of SCAI, Society for Cardiovascular Angiography Intervention. Is a prestigious American fellowship which was bestowed upon less than 100 people in India among thousands of cardiologists. I am lucky and honored to have that fellowship, which makes me basically to do complex interventions, coronary intervention, structural heart disease, and other interventions in cardiology. But my heart lies in preventive cardiology. I am a fervent supporter of preventive cardiology. Basically, we know that 80% of the heart disease can be prevented, and what we treat in the hospitals is only 20%, tip of the iceberg. So we are basically looking at treating patients who are terminally ill and who are brought with a disease after damage to their heart. Instead, American Heart Association says that 80% of this can be prevented, and my field of interest is preventive cardiology, where I educate my patients, where I risk score. That means I have risk scores where if a patient walks in, I can say what is the risk of the heart attack in next 10 years, so that we can group them into high risk and low risk categories, and we can focus upon the interventions, lifestyle interventions in that kind of a group of people. I am also interested in hypertension. 1 out of 3 adults in this country has hypertension. Is a huge burden, and almost 20 to 25% have diabetes, and with increasing obesity and lifestyle, we know that now the heart disease are increasing. And in case if we make our people who walk into our hospital and the layman and the public people to educate them regarding the risk factor control and modification, largely the heart attack can be prevented. So that's what I am into, cardiology and preventive cardiology. I am also interested in the cholesterol and its management. High cholesterol is the leading cause of heart attacks, and regarding the cholesterol management, both in the way of lifestyle and the drug management, I am specifically interested in. So these are my fields of interest. I have a dual role to do, both in interventions one side and as a preventive and hypertension control and cholesterol management. And I have passion to become a leading preventive cardiologist in India, so as to reach for masses and makes significant difference in the outcomes of heart diseases in this country. We at KIMS have probably the most complete department, where we have cardiologists treating from the newborn children, doing major surgeries for the low birth weight children, complex cardiac surgeries, to preventive cardiology as I am doing, to the interventional cardiology, which I am also part of it. We do complex interventional procedures, we do treat structural heart diseases, we do electrophysiology in our department. Basically the important thing about the KIMS cardiology department, we work as a cohesive force, as a family, as an integrated unit, where we exchange ideas and then we work together for the patient safety and the best of the management of the patient. I am quite happy and proud to be in the KIMS family.